bringing us home, we're going to start with Professor Chris Doran. He's out of the Hunter from Newcastle, a real Newcastle sort of push in this conference, I've just realised. And Chris works in a really interesting area of health economics. You know, it's people don't just give you money because they think you're nice people. There's got to be evidence. There's got to be outcomes. You've got to be able to prove that your intervention and your strategy actually is evidence-based and works. And there's not a lot of people in Australia working in this area, but Professor Chris Doran is. And so I was delighted Chris can speak at the conference. I'd like you to make him really welcome.
Thanks, John. Unfortunately, I am a numbers man, so it's fairly dry talk, but it's policy relevant. So that what I do, health economics, I have a background in drug and alcohol research, so I've done a lot of work around addictions, particularly heroin addictions and alcohol, tobacco. Recently, I've been moving into the cancer area, branching out from the drug addictions. But the focus of the work that we do at the Hunter Medical Research Institute is more about translational research. It's about looking at the impact of research. So I've been an academic for 15, 20 years, and now I'm with HMRI. It's a not-for-profit organisation that works with the community and with the local health district. And it's about, they talk about bench to bedside. It's about trying to translate research into policy relevant things. So it's about the focus of research these days, medical research, is around impact. So that's where some of the skills of health economics come to the fore in terms of looking at the costs and benefits of what we do, not only in Matesin construction, but across all medical research. So I was fortunate enough to be invited to work with Jorgen and the team last year actually, on a social impact proposal. So they were looking at trying to implement Matesin construction into the New South Wales construction industry using the Queensland model. So essentially, I put together a proposal, and it was commissioned by, it was funded by Matesin Construction Queensland. So repetition, sometimes a good thing. So we've heard this morning, suicide's a big problem in Australia. It's actually, more people die from suicide than road and traffic accidents. More people die from suicide from breast cancer, and around the same people die from suicide as prostate cancer. And you know, breast and prostate cancer, they're massive funding organisations, lots of advocacy. So I think it's about time that mental health had the same space in Australia and indeed elsewhere. So some of the information that I've got up on the slides, it's a problem in the working age population, and it's not just in the construction industry, it's across all industries. So there's some work by a lady called Alison Milner, who's looked at the risk of suicide by qualification. And it's interesting, the ones at the top and the ones at the bottom of the skills are the ones that are more susceptible to suicide. So they say it's a stepwise gradient, but the ones at the top do have a higher proportion of suicides than those middle-level managers. In a separate analysis, Milner also confirmed this within the construction industry. So that's something that we're trying to push mates in construction to think outside the box. It's not only the construction industry. We're working with people like Brian Kelly around the mining industry. I'd like to apply some of this stuff to the health industry, education sector. It applies equally to the workforce. So as the aim of the study, essentially there was two aims. What we wanted to do was to quantify the economic cost of suicide in the New South Wales construction industry, and then to look at, if Matesin construction was rolled out across the construction industry, what would be the potential benefit to the government of doing that? So to answer our research, we had to collect information on three sources. Essentially, we needed information on the rates of suicide and self-harm in the construction industry. We needed information on the cost of suicide, and we needed information on the effectiveness of mates in construction. So the rates of suicide. So Graham talked earlier about some of the information from the National Cranial Information System. So we use that information. So the information that Graham quoted, that was the source for our information on suicide. There was a whole heap of coding, and there's a whole heap of issues in terms of trying to identify construction industry workers, and that's a minefield in itself. So in our analysis, we looked at technicians, trades workers, machine operators, drivers and labourers. So one of the limitations is we didn't include professionals, we didn't include managers in our definition of construction industry workers. So in a sense it underestimates the true reflection, true potential benefit of mates in construction. Graham also talked about the age standardised rates, so I'm going to put some data up that looks at the raw numbers, but to get a better comparison across state, across industries, it's important to look at the age standardised rates. That takes into account the population structure. The slide I missed was some information that's been reported before. The World Health Organization, 20 to 30% of the workforce will suffer from a serious mental health problem, and for every employee who dies by suicide, another 10 to 20, the states have evidence to suggest it's up around 25 to 30 people will self-harm. And this is an interesting statistic in itself, because we've been talking a lot about suicide, and predominantly males commit suicide, but self-harm, predominantly it's females, and it's a rate of around 15 to 1. So in New South Wales, I think in 2010, there was at least 60,000 admissions to the emergency department for self-harm. So it's a huge issue. So when you're talking about the benefits of mates in construction, it goes beyond just saving lives. It's about saving communities. So for this analysis, we've taken the World Health Organization metric to say, okay, well, for every one fatality, there's 15 suicide attempts. And out of those 15 attempts, we've used some definitions that have been picked up in a Safe Work Australia report that looks at 17% of those result in permanent disability, so off work for the rest of their life, and the rest of those are classified as short absence from work. So we obtained the information, we had identified the number of suicides. This is a challenge in itself because the information is less than perfect. Depends where you go. Even the ABS, the Australian Institute of Health and Welfare, have less than perfect information on suicide in Australia. So these are just raw numbers. The information at the bottom shows there's considerable variability for a number of reasons. The average age of suicide rates, it's around the same in both of these states, around 37 years of age. So there's a big variance there, but on average, the mean age of suicide death, fatality, is around 37 years of age. A more accurate comparison is, as I mentioned before, age standardised rates. So unfortunately, I haven't got my laser pointer. I can't show you exactly what these diagrams mean. The top one is the Queensland construction industry versus Queensland. So the top line, these are age standardised rates. The top line shows you Queensland construction industry, and the orange line is the state average. So it basically shows that the rate of suicide is higher in the construction industry, but over the last couple of years in particular, it's been getting closer. So this is a key theme of Graham's paper, that we're starting to bridge the gap between construction industry rates of suicide and the state rates in Queensland in particular. The bottom graph shows New South Wales, and it's still a little bit all over the place. Construction industry workers are more susceptible to suicide according to the age standardised rates. So the cost of self-harm, I actually presented last year about our plan of attack, what we're going to do, and we had undertaken a comprehensive review of the literature of what we knew about the costs of suicide. There's been a few studies done, and economic methodologies vary. There's lots of criticisms, there's lots of assumptions, there's lots of ways in which you can do it. So we didn't really want to reinvent the wheel. We wanted to come up with a standard, acceptable measure. So what we ended up finding was a report that was recently conducted by Safe Work Australia, which looked at the cost of work-related injury and illness for Australian employees. And that had been ratified over a series of 10 years. It had been improved, endorsed and refined. So we were able to take this methodology off the shelf, and that provides a bit more rigour and robustness to our methods. It used 5 categories of severity according to the length of time people were off work. So it looked at direct and indirect costs. So for example, medical costs. It looked at direct productivity costs. It looked at admin costs, medical costs, and a whole range of other issues. I did have a slide that went through exactly all of these components, but I took it out because I thought it would be too boring for the audience. So what we did, and there's actually a report that I didn't bring up, I'll refer to later. So what we ended up doing was coming up using this methodology to work out how much is the cost for self-harm, how much is the cost for fatality and full incapacity. And then we multiplied that with the number of fatalities each year to come up with the total cost of suicide. We used an incident-based approach. So basically we looked at the number of cases in a particular year. So it's more appropriate for economic evaluations because programs like Mates in Construction is about averting disease. So if you have an estimate of what the disease costs, what the condition costs over a lifetime, then you can match that with the potential benefit. So different subtleties in economic methodologies and dollar values are converted to current figures. At the end of the day, what we ended up coming up with is consistent with the estimates in the Safe Work Australia and estimates generated by other private consulting companies. Essentially, each fatality costs society around $2.14 million. So each fatality, $2.14 million. People who full incapacity case is around $2.78 million. A short absence from work is around $925. So the key cost driver in all of this is lost productivity. So if someone's dying, the last bullet point there, given the average age of each suicide is 38 years in New South Wales, this equates to 27 years of lost employment, lost income, lost taxes. So from an economic point of view, that's a lost productive aspect of society. So putting all that information together, New South Wales, in 2010 there was 57 fatalities. That equates to then 145 self-harm attempts, 710 attempts resulting in short absence, you can read. And essentially, those two components come up with a figure of around $527 million in 1 year. So it's an underestimate because it doesn't take into account people who have been in the system, who have tried to commit suicide in the previous years. It's just incident figures for 1 year over a lifetime. So $527 million, so it's a substantial cost just for New South Wales. The last aspect of the study tried to tie that in with the potential benefit of Mates in Construction. So how effective is Mates in Construction? So the information that we had to work with was data from Queensland. So I'm not going to go through these numbers because there's been some controversy over the accuracy of these ones. But essentially it demonstrates over the period in Queensland from the year 2008 to 2013, as opposed to how many workers there are, the number of people that have participated in the training, the number of people that post-vention sites, hotline calls, and essentially it's been increasing. So what we did use for this is the last bullet point there. Over the period 2008-2013, the average penetration rate of mates into the Queensland construction industry was around 9% per over the average. That's the proportion of the workforce exposed to the general awareness training. So I'll come back to that later. But essentially, this is a similar type of approach to how they want to try and roll it out, or how they did want to roll it out in New South Wales and other states. Graham also talked about the US study, NOx. Again, there's lots of pros and cons of using an international study. One of them is that it's around suicide, and one of them is they have an existing method to evaluate their program. And essentially, it's just looking at the risk of suicide before the program, comparing that to the risk of suicide after the program. So that's what we did in Queensland in a nutshell. We looked at time series data on 5 years immediately before the commencement of suicide, for the commencement of mates in Queensland, 2003, 2007, and post-mates. So essentially that's the relative risk ratio that we used for ours. We had the data, we compared the two rates. So this is a bit of a messy diagram as well, but you can sort of see this is for Queensland construction industry. So it's all got to do with those dotted lines. So the blue line represents the rates of suicide in the construction industry pre-mates in construction. The red line, or orange line, depends on how colourblind you are, looks at post. So essentially the slopes are a little bit different. Across New South Wales was coming down pre, but after mates in construction it was a steeper slope, so it was coming down even even faster. So what we ended up finding for the Queensland construction industry, that the risk of suicide decreased by around 9% in Queensland after the introduction of mates. And that's exactly the same approach that Graham talked about in his paper. So it's the same sort of logic. So from that, in the New South Wales construction industry without mates, if the risk of suicide continued on, business as usual, there'd be an estimated 217 fatalities by suicide over a 5-year period. With mates, we estimated that if it had the same impact as it did in Queensland, there'd be 196 fatalities by suicide. So there's a difference of 21 fewer suicides over 5 years post-commencement of MIC. We took the conservative approach. We didn't attribute that whole reduction to mates in construction because we acknowledge there's a lot of other noise, there's a lot of other information and policy programs out there. Beyond Blue are doing things, the National Suicide Prevention Program. So what we did, we conservatively estimated that as a consequence of mates, we looked at the penetration rates of mates. So a reduction in fatality by suicide as a consequence of mates to be not 21 suicides, but 1.98 suicides over a 5-year period. So that's the measure of effectiveness that we used in our study. So if mates in construction was rolled out in New South Wales using the same level of effect that it had in Queensland, and the same penetration rate, this is what we'd hope to achieve. And then it's not rocket science when in economic evaluation you put the costs and the benefits together. And this is where the importance of using an acceptable, a standard methodology for generating cost estimates come into play. It's a plausible cost estimate, it's robust, it's got some science behind it. We estimated that the cost of suicide was around $527 million. It's big business. It's particularly interesting when you start to get into the cost to the industry in terms of productivity and absenteeism, presenteeism, absenteeism. So based on our estimated effectiveness of Queensland, of 0.4 suicides and the self-harm reductions, the potential benefit of reducing that harm equates to around $3.66 million. So for an investment of $800,000 a year, as opposed to a benefit of 3.66 million, that's a cost-benefit ratio of 4.6 to 1. So it's a little bit different to maybe cost effectiveness or a cost utility. It looks at cost per program, cost per participant. It actually translates it to dollar terms that policymakers can understand. So for every $1 invested in mates in construction, society can benefit $4.60. It represents positive social return on investment. So just a few strengths and weaknesses of the study. I've only got a few more slides. One of the strengths is we used an industry-relevant measure to look at the costs of suicide and self-harm. I alluded to some of the weaknesses, and this has been picked up before in terms of the data. The data's not perfect. Even the information on suicide rates, that's a bit of a minefield in itself. So I think moving forward, we really need to get better information, better measures put in place to actually look at not just the process measures in terms of the number of people being trained, but the outcomes of that. So what are the implications of going from a helpline to actually engaging with the services? What are the implications of that in terms of healthcare utilisation or other aspects of delivery or improvements in health? And how does that translate into saving lives? So we still have a way to go in that regard. It's a conservative estimate, we believe, because it doesn't take into account a lot of the impacts to the industry. And again, wider implications to the industry in terms of damage to property, loss of reputation, or the investment in work health and safety regulations. It doesn't include all workers. I've mentioned that before. It's just focusing on the lower skilled ones. But equally as important is the professionals, the managers. It doesn't include the cost saved by the transfer of knowledge from the employee, learning workplace safety tools at work, and then applying them to family and friends outside of work. So there's been a theme in this conference and one last year about the ripple effect of suicide. So, you know, for every person that dies by suicide, there's 6, 7, many more that are impacted. So mates in construction has the potential benefit to save much more than just the financial dollars that are estimated in this report. So the key message that the key conclusion that we came up with is MATES is a feasible, affordable and acceptable workforce strategy that addresses suicide in the workplace. It represents a positive economic investment into workplace safety in the New South Wales construction industry. Where to from here? So we've launched a report. This report's been peer reviewed by a number of people. Currently it's under review by an international journal. We're in the process of developing state-based estimates, so we have the information on suicides. For example, if you just use our cost estimates to look at the 201 fatalities by suicide in 2010, that comes out to be $1.8 billion. So this is consistent with other estimates, but it provides, I'd like to think, a better methodology and a more accurate costing. But they're big numbers. Victoria, there was 45 fatalities by suicide in 2010. It's around $407 million. Western Australia, 24 fatalities by suicide, $222 million. So I think the rationale for developing state-based estimates is for them to take it back to their state governments and argue the potential cost of suicide and then the potential benefit using some of the work that we've done to justify additional spending on programs like Matesin construction. Where to from here? Ideally, I'm out of time, but I've only got one more slide. Obtain better measures of effectiveness of MATES. So intervention and control sites. This arrangement with Lend-Lease, that provides an ideal opportunity to develop some measures that you get a better handle on what's going on at the ground level. Extending MATES to other industries. Brian Kelly alluded to the work that we're doing in the mining industry, but I also think it has relevance to every other industry and globally as well. My last slide, I'd just like to acknowledge John and Jorgen in particular for putting up with me over the last 12 months. And I'd like to acknowledge the involvement of Annette from Lend-Lease, Alison Milner, Sarah, and a few other people that reviewed this. The Mates in Construction, in particular, their board members, they provided feedback, looking at problems with the report, and we tried to strengthen that. And that's all I've got. Thank you.